All right, this installment of Hanging with Dr. Hern is going to talk about nosebleeds. I know it doesn't sound like a really sexy topic, but it's a topic that freaks out a lot of people, and it causes a lot of anxiety both for the providers and for patients. I want to share with you a couple tips and tricks that I've learned over the years and that have been taught to me by my superiors and by some ENT folks, some ear, nose, and throat specialists about nosebleeds. It's one of the areas that I actually lecture on, so I want to pass on some tips. So nosebleeds, right? They're messy. Blood's everywhere. Sometimes it can be really bad. People are sneezing and that sort of thing. The most important thing is that you protect yourself. Right? For those of you who have seen me doing any of my talks about dialysis patients and that sort of thing, blood that is going places because people are sneezing, that's dangerous. So wear your eye protection, wear gloves, all those things that are important for personal protection, just so that you can take care of yourself, take care of your community, and take care of your patients better. Once you're protected, then you feel better about taking care of other folks. The other thing that's interesting about nosebleeds is where they occur. The nose, if you take a cross-section of the nose, and I'm about to do a really terrible drawing because I'm not an artist, but if the nose comes out like that, right? All right, nose, lips, something like that. If you take a cross-section of the nose and just look at the nose, if this is the wall in between the two nostrils, the wall has some really, really interesting blood vessels that come in and all form what we call a plexus. And this is an area that is, the blood vessels there are really thin and really close to the surface. So it turns out that this area is called Kesselbach's plexus, and it's fed by about 4 different arteries. What's interesting is that when nosebleeds happen, they happen mostly here. But wait, why am I talking about nosebleeds? What's the big deal? Nosebleeds happen all year round, right? Well, yes and no. If you're a little kid and you're picking your nose, yeah, nosebleeds happen all the time. But nosebleeds are particularly worse in the wintertime. And why is that? What do you think? All right, I'll give you a couple seconds to think about it. Why are nosebleeds worse in the wintertime? What else is worse in the wintertime? Well, colds, right? So people are blowing their nose more. It's more irritating. And what about, it's cold outside. So it turns out that what people do is, they turn on their heaters. Well, most heaters are forced air heat, and it's really dry. So heaters actually dry out the air, and when you have a really dry air, people who tend to have nosebleeds actually get more of them, okay? So that center part of the nasal mucosa gets really dried out, and people have a lot more nosebleeds. So it's actually a function both of the illnesses, the coughs and colds, etc., but also the time of year. And that's something that's sort of interesting, but it's certainly, we're starting to see more and more of them, okay? So who's at risk for nosebleeds, right? So people who are sick, have viruses, colds, people who are on blood thinners, right? So people on blood thinners, people who've used intranasal cocaine, so drugs. It really thins out the mucosa. People who are chronic nose pickers. Exactly. Anyway, so again, 90% of all nosebleeds happen probably in the first inch or so of the nose, which is sort of interesting because it really allows us to actually address the cause of the nosebleed first. So how many people have seen, you get to a patient's house, they're like, oh, I got this nosebleed, and they have a piece of tissue paper shoved up their nose, they're leaning back, they're like, I got this, and they're spitting out blood because the blood's going down the back of their throat, and they're like, they've shoved paper towels up their nose and things like that. Happens all the time. Turns out that there's actually a much better way to address the nosebleed itself. Firstly, it's the position. Okay, so you have to apply pressure, and you have to apply pressure in the right location, in the right position. Okay, so the patient who has their head tilted back, do you think that that's the right position? Given that most of the nosebleeds happen here, do you think that would be helpful? Actually not. When the nose is tilted back, all of that blood just runs back and down the throat, okay? Not good. it's really irritating to the stomach, then they're vomiting, and then do they actually have a GI bleed versus actually a nosebleed? So that actually doesn't help at all. The most important thing is they need to lean forward, and then they need to apply pressure in the right location for the right amount of time, okay? So basically, this is the time for audience participation. I want everyone to feel their nose way up here on the bridge of their nose, okay? Probably have chalk on my fingers. Way up here on the bridge of their nose, and then work your way down. Feel where the bone suddenly sort of ends and it becomes a lot mushier. That's cartilage, okay? So that is actually, that you can squeeze a little bit. So you can't really squeeze the nose very well up here because that's bone. But if you go down a little bit farther, you could actually squeeze and actually close off the two sides of the nostrils. Okay, so you close, and what that does is that applies pressure. The side of the nostril actually pushes up against the center wall of the nose, causing the ability of the Kesselbach's plexus to actually clot off. It's all about direct pressure. Sure, if you jam a whole lot of cotton up there or paper towels, etc., you might get enough pressure. But the most important way is actually the patient themselves can produce the right amount of pressure. Again, they start up high and they come down and to the fleshy part, and then they squeeze. It has to be a little uncomfortable. They actually have to squeeze so much so that it's not the greatest. It's not, it's actually a little bit uncomfortable. And then they sit there, okay, with their head facing down. Some people actually say that you put your palm into your chin, and then you reach up with your thumb and forefinger, and you pinch off that way. And that leaning forward just a little bit causes a good amount of pressure, and that is able to tamponade or cause clotting for probably 90% of nosebleeds. These are ones we can actually solve without a whole lot of intervention. It's shocking how often this isn't followed, but it's an incredibly helpful thing. So pressure, and then how long do you keep it on for? 5 minutes, 10 minutes. Honestly, you should probably tell the patient to keep it on for 15 full minutes because that'll probably stop the bleeding most of all. Okay, so we've gone through a little bit about nosebleeds, the risk factors. Obviously, if they're sick, they've been putting their fingers in it, they're using cocaine, they're on any kind of blood thinners, including aspirin, Plavix, Coumadin, any of those will actually cause you to have more blood pressure or more nosebleed issues. If they're hypertensive, they don't necessarily cause more nosebleeds, but it's a little bit harder to control. Anyway, if the direct pressure doesn't work, there's lots of other things we get to use in the emergency department. We can cauterize, we can put in nasal balloons to get that pressure going. And again, that solves probably 90 to 95% of all nosebleeds. That's a quick, brief update on epistaxis or nosebleeds. That's it for Hanging with Dr. Hern this time. Thanks.